Hi there. I wanted to spend a few minutes addressing a couple of misunderstandings about COVID-19. First, I'll talk about flattening the curve, and second, I'll cover pre-existing conditions. I see a lot of angry posts from people saying, if everyone will just stay home, this will end faster, but honestly, that just shows that they're misunderstanding how it works. We're not conducting a siege where if we wait long enough, the virus is going to lose interest and go away. The pandemic will end when enough of the population has antibodies that the virus runs out of potential hosts. For most vaccines, this herd immunity, as it's called, is achieved through vaccination. But since no vaccine is expected for about 18 months, the only way to acquire herd immunity is to expose enough of the population to the virus that the number of potential hosts is so limited that COVID-19 can't spread quickly anymore. A couple of ways to do this. So on one hand, we could just expose everyone to the virus. But this virus is highly contagious, so a large number of people will catch it quickly. Thankfully, not everyone who catches it shows symptoms. But even if a low percentage of the population gets sick, it may still be enough to swamp the hospitals, and that's what we're trying to avoid. Swamp the hospitals, not have enough supplies, etc. So health officials have asked us to help them flatten the curve. Now, what flattening the curve means is it means exposing society to the virus at a slow enough rate that the hospitals can handle it. Well, let me repeat that. Flattening the curve means stretching the curve so it will fit under the medical capacity line. The same number of people get sick, but it's spread over a longer period of time. So what if your hospital is empty? Well, if your hospital is empty, then you've probably overdone it a little bit. If no one's sick, then you're not getting any closer to the goal of herd immunity because everyone's still a potential host. So we're all just sitting at home and we're no closer to herd immunity. Well, then you say back to work. Well, not so fast, kiddo. The expression going viral exists for a reason. If we go back to life as usual and expose everyone at once, we overload the system and lots of people will die. It's just really such a delicate balance. How do you expose people at just the right rate? How do you gradually expose everyone to the virus without it taking off, without it going viral? How do you get the infection rate just right so that the number of people needing hospitalization doesn't exceed the healthcare system's capacity like it did in Italy or New York? It kills me that people think low infection rate is the goal, or they celebrate, hey, our state has a really low infection rate. Really, a low infection rate just means it's going to take a lot longer for everyone to get back to work. The goal is actually a slow and steady infection rate, or a vaccine or something. And do you see the challenge our health officials are facing? And to complicate things, not everyone is equally susceptible. Some, such as the elderly, are at much higher risk. So not only do you need to make sure that people are getting exposed at the right rate, but it needs to be the right group of people getting sick. So now let's turn to pre-existing conditions for just a minute. I've seen reports that as many as 90% of COVID fatalities have pre-existing conditions. And for that reason, I've heard a lot of people argue that we can't really take these statistics seriously, that people with pre-existing conditions shouldn't really count because they were already sick. Why should we count sick people? Anyway. But again, I think we're misunderstanding the term. So in 2013, the National Health Council released a paper saying that the number of Americans living with or managing a chronic health condition was 144 million. Now, it only limited the activity of 40 million, but 144 million Americans had chronic health conditions. That's 40% of the population. And this report predicted that by 2020, the number is expected to reach 157 million. with 81 million having multiple chronic health conditions. So pre-existing condition doesn't mean nigh unto death. If you're over the age of 40 or 50, there's a pretty good chance that you have one. And there's a decent chance that you have more than one. By the way, for those of you who subscribe to the channel, that's the goal, is to help avoid you become part of that 40%. If you haven't subscribed yet, there's room for more. Anyway, so to dismissively say, well, we can't attribute their deaths to COVID-19 because they were sick anyway, that's to just grossly misunderstand what's meant by a pre-existing condition. If 40% of the population is managing a pre-existing condition, then yes, a very high percentage of COVID fatalities will have pre-existing conditions. And a lot of them will have multiple pre-existing conditions. Duh! That's what our population consists of, is people with pre-existing conditions and multiple pre-existing conditions. That doesn't mean they don't count. That doesn't mean it's okay for them to die. Anyway, I don't have a silver bullet solution, but hopefully this helps put the situation in perspective. We need to flatten the curve, which sadly means we have to get sick. But, oh man, how do you get sick at the right rate? And number two, don't dismiss stats just because somebody had pre-existing conditions. It doesn't mean what you think it means. That's all I have. Talk to you later.